Hello everyone. Today, we're tackling a question that causes significant concern for many, especially younger individuals. Can young people actually be diagnosed with dementia? It's a topic often surrounded by misconceptions. Dementia is widely associated with aging, and it's true that the risk increases significantly with age. However, it's important to understand what dementia truly is. Dementia isn't a single disease. It's an umbrella term describing a syndrome, a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. These symptoms are caused by damage to brain cells. While Alzheimer's disease is the most common cause, many other conditions can lead to dementia. When dementia symptoms begin before the age of 65, it's referred to as young-onset dementia or early-onset dementia. This is less common than late-onset dementia, but it does occur. It's estimated that a significant number of people worldwide are living with young-onset dementia. This highlights that it's not an exclusively older person's condition. The experience of young-onset dementia can be quite different from dementia in older adults. This is partly because the types of dementia and the symptoms can vary. Diagnosing young-onset dementia can be challenging. Symptoms in younger individuals are sometimes mistaken for other conditions. These can include depression, stress, anxiety, or even relationship problems. Doctors may not immediately suspect dementia in a younger patient. This can lead to delays in diagnosis, which can be frustrating and impact the ability to plan and access support. Awareness among both the public and medical professionals is crucial. While Alzheimer's disease is the most common cause of dementia overall, other types are relatively more frequent in young-onset cases. Frontotemporal dementia, or FTD, is one such example. FTD often affects personality, behavior, and language more prominently than memory in the early stages. This contrasts with typical Alzheimer's presentation. Vascular dementia, caused by damage to blood vessels in the brain, can also occur in younger people, especially those with risk factors like high blood pressure or diabetes. Lewy body dementia, characterized by fluctuations in alertness and visual hallucinations, is another possibility. It's clear that young-onset dementia isn't a single entity. The symptoms of young-onset dementia can be diverse and may not always start with memory loss. Changes in personality or behavior are common early signs, particularly with FTD. Someone might become unusually impulsive, lose empathy, or show poor judgment. They might develop new obsessions or repetitive behaviors. Language difficulties are also frequent. This could involve trouble finding the right words, understanding conversations, or speaking fluently. Other symptoms can include problems with visual processing, difficulties with planning and organizing, or changes in motor skills. Memory loss does occur, but it might not be the first or most prominent symptom. If you or a loved one are experiencing persistent, concerning changes in thinking, behavior, or abilities, it's important to see a doctor. They will conduct a thorough medical history and physical examination. A neurological examination will assess reflexes, coordination, and sensory perception. Cognitive tests will evaluate memory, thinking, problem-solving, and language skills. Brain imaging, such as MRI or CT scans, can help identify structural changes or rule out other causes like tumors or strokes. Blood tests are also used to exclude other conditions that might mimic dementia symptoms. Sometimes, a lumbar puncture is performed to analyze cerebrospinal fluid for markers associated with certain types of dementia. The process aims to accurately identify the cause of the symptoms. A diagnosis of young-onset dementia is life-changing, not just for the individual but for their family and friends. It can impact careers, finances, and family roles significantly. Emotional support is vital. Individuals and families often benefit from counseling and support groups specifically for young-onset dementia. While there is currently no cure for most types of dementia, treatments and strategies can help manage symptoms and improve quality of life. Medications may help with cognitive or behavioral symptoms. Non-pharmacological approaches, such as cognitive stimulation therapy, occupational therapy, and physical exercise, are also beneficial. Maintaining social connections and engaging in meaningful activities are important. Planning for the future, including legal and financial matters, becomes a necessary step. Support services can help navigate these complex issues. It's important not to jump to conclusions if you experience occasional forgetfulness or feel stressed. These are common experiences and are not typically signs of dementia. Dementia involves a persistent and significant decline in abilities that affects daily functioning. If you are genuinely concerned about noticeable, progressive changes in yourself or someone you know, seeking professional medical advice is the right step. A doctor can properly evaluate the symptoms, conduct necessary tests, and provide an accurate diagnosis or rule out dementia. Early diagnosis, even if difficult, allows for earlier access to support and planning. So, to answer the question directly, yes, young people can be diagnosed with dementia. It's less common than in older age groups, and the symptoms and types of dementia can differ. Awareness of young-onset dementia is growing, but more is needed. Understanding the potential signs and the importance of seeking a proper diagnosis is key. Living with young-onset dementia presents unique challenges, but support, management strategies, and planning can make a significant difference in the lives of those affected and their families. Thank you for watching and learning about this important topic. If you found this information helpful, please give this video a like. Leave a comment below with any questions or your thoughts. And don't forget to subscribe to our channel for more informative content like this.